All right, thank you guys for joining us today. We are close to the end. It's been an awesome journey and an awesome adventure. There's been a lot of learning, right, that we've actually done. So today, I hope you guys all had a really good holiday. It's good to get back to the grind, and it's also good to get back to, having those, seeing that there's going to be some changes. So change is always good. It can be frightening at times. We don't know what the year holds ahead of us, but we're going to take it in stride, right? We're going to roll with it. So what we're going to do is we're going to jump into this very quickly because we need to go over our volunteer projects. So I had mentioned earlier, to those of you who were on or a little bit earlier before we actually started recording, because this is our first module cohort that we've done within our tribal communities. I had mentioned this to Claire. I talked to Cassandra yesterday, but I would really like to get some feedback from you guys, either via a survey or maybe just, we'll figure that part out. But I would like to get feedback from you as participants, how you felt this type of presentation went, because my idea when I went into this was that this would be a help. These weekly meetings would be help and would be able to, offer support, answer questions. But I'm wondering, like all ideas, sometimes they don't work out the way you would like them to. So this is where the feedback from you is important. I would like to kind of get some feedback on, do you feel that this would be more beneficial if we did it as a class, like we did, each week you had to go through like a class, each one of these modules. So be thinking about that, because remember, we're wanting to hopefully this program is going to be able to be spread through our other tribal communities, not just with our own Ute tribe, but also with our Paiute tribes and our Ute tribes. So be thinking about that, and let's do what we can to start refining this. So your feedback is extremely important. Even when you finish your modules, right, if there's any sort of survey, please make sure that you fill that out. Give some honest feedback, because the feedback you give is what is going to help improve these programs. But it's also going to be able to help our tribal communities to, reach our tribal communities and to help our tribal communities engage. I would also like you guys to be thinking about possibly if there comes a time when maybe you may be the person who could volunteer and run a cohort through Master Help Volunteer, if that's possible. So think about ways that you can also take this program and, transcend what it's just designed to do to bring it to our tribal communities. Because I think each and every one of you have expressed learning something very, very valuable from the different modules. And so it's all about empowering our tribal communities, right? And you guys are the ones to be able to empower them. All right, so volunteer projects. So let's turn very first back to page 43, which is in module 2, if you have your workbook. Let me get it on the screen. Now, just a quick little shout out. How many of you guys have actually started with the first steps and completed those first steps for your volunteer project?
So you're going to page 43, right?
Yes, 43, the volunteer project first steps.
Yeah, it says, okay.
All right, so can you guys all see that?
Okay, yeah.
Perfect. All right.
The first steps are like, what are three needs you see in your community, right? Is that what you're talking about?
Yep, let's see. Let me get
back.
Okay.
Oh, I see. Oh, no, okay.
Yep. So the community needs and resources. So this is just when you start laying that groundwork down, right? We have like
Yeah.
contact information. So first and last, what are 3 needs you see in your community? Now remember, this was designed to help walk you through this so it can be like, so it's not one big chunk that you have to do all at one time, to kind of gradually start to build up. Were you guys able to complete this first on page 45, this community basic needs and resources? Perfect. On this page, did you guys find any challenges? Did you have any challenges personally? Did you have a hard time defining what interests you?
Well, like when I first started doing this whole thing, I had trouble with it. But now that I'm up, almost finished with the intellectual one, I kind of have like more of an understanding. Plus, what happened over the holidays too, and like what we really need or how I can contribute. So it'd be easier for me to fill out now rather than back then.
All right, that's good to know.
Also, I don't have this in my little binder. I don't have this page.
Oh, you don't? Okay, that is also good to know.
And then plus, because I didn't get my binder until module 3.
Okay. All right.
I don't have it either, Michelle.
All right, so no page 43 in your books. Okay, that most definitely is a problem, right? Okay, I will get those to you guys. So who else does not have that? So it's Shay and Jenny, was that you?
Yeah.
Okay.
Yeah.
Anybody else?
What was the question?
So the question, that's exactly how I feel sometimes. What was that question? So we're going over just kind of like this first community needs resource, and there are a couple people who do not have the papers for the volunteer project. So the question was there anybody else? So this is what the cover page looks like for this planning part 1 in your book. And then it steps through, and I was wondering, did everybody get this on page 45 completed? It's just the basic contact information, what your 3 needs that you see in your community, what are some resources you are aware of in your community that can help meet those needs, and what are some passions or interests you have related to health and well-being. Okay, the next one, so that was our very first step. Then our next part is introduced on page 53 in your workbook. So the volunteer, go ahead.
Community needs and resources, like right off the top of my head, I could fill it out. But I didn't fill it out, but like I could fill it out because like recently, Jonah accepted a challenge thing, like the 75-day hard challenge. So our goal from last year is to be more our health and like our diet and stuff. So now I don't like to diet. It's so hard to diet, so we're dieting again. And so yeah, I can say yes, I completed this just by saying that I could fill it out right now with my brain. So
okay.
I'm chiming in. I finished.
So the first opportunity, so after we're done with the group, I want to challenge you to make sure you have that first page filled out. There's science that shows that, I mean, it's very beneficial to help us keep on task when we can actually write down what we need to. So make sure you have that page written down. And then we're going to move again to page 53, which is in module 3. Now on this one you should have completed the occupational health section. It is time to continue planning your volunteer project. So for this step of the volunteer project, let's see, brainstorming. Did you guys have an opportunity, for those of you who had these pages in your workbook, to brainstorm? Shay and Jenny, did you guys have these pages, or is it all of the ones for the project, the volunteer project that you're missing?
I have this page.
Okay, it was just the first one. All right.
Yeah.
All right. So, did you guys have an opportunity to complete your volunteer project brainstorming?
I started.
Okay.
The contact information she was talking about?
So what health and wellness areas are you personally interested in? I know we have had some discussions about that, and you guys have vocalized some of your areas that you were interested in. Now remember, this part of the volunteering to get your volunteer project going is to help you kind of start pinning down where you're really going to go, because when we brainstorm, right, we have all these brilliant ideas. It's good to put those ideas out there. Now we need to get those ideas pinned down to where we can start focusing and moving forward with an objective. So if you have not done this, please get this done. I'd like to encourage you to get that done. On the back side of that, one thing I realized, this is just a quick side note, I use a lot. That's a lazy word. So my challenge to myself is to stop saying So volunteer project brainstorming. What groups of people are you interested in? Why are you interested in working with those groups? How will you work with those groups? How will working with those groups help you make a difference in your community? So I want you to kind of see how when we start doing volunteer projects, or when we start having projects, the more personal investment and interest we have in it, the more passion we have towards it, the more likely we are to follow through with it. As I've mentioned to you guys before, the way this is laid out is very, very beneficial, because it will help you engage in future projects. So it lets you know, why are you interested in this? You have to have an interest. There's nothing worse. I guess I wouldn't say worse. Oh, I did it. I'm going to do a tally. So there is nothing that is less beneficial than when you're not truly invested in a project. You don't put your full effort into that. And that's why it's really important to make sure that what you're doing in your projects are something that you're really interested in. Because when you're more interested in it, you're going to look at it and actively engage in it differently. So this part of the brainstorming project is extremely important. Each one of these steps that we're going through are very important, because they're the steps to get you to the top of your project. So if you have not finished that, please sit down and get that done. Like I had mentioned to Miss Cassandra yesterday, we're going to look at times when I can come over to your guys' office, of course, like I said, doing social distancing, and sit down with you guys one-on-one if you would like, to go over your project, to help, with any aspect of your projects and any of the modules and the work on your modules. You are also welcome, if you just let me know, to come over to my office. We can work on that. So finish up page 58 if you have not already done that. So the next review we have on our volunteer project is the planning on part 3, which is on page 85, which was in module 6. Now, I know not everybody had the opportunity to participate in our module 6 course, which was the 22nd of December, that week of Christmas. So on module part, on our module 6, which was on the financial health, which is ironic that it was during Christmas, right? Because most people go to debt during Christmas. How many of you guys have completed or started working on your module 6?
I've completed mine.
Perfect. Okay, so what kind of help, what kind of support can I offer any of you guys to help you complete and succeed at pinning down times to work on your modules? Feedback is always good. So I want you to be thinking about that. You can personally email me if you'd like to. to let me know that. So now we're looking at volunteer project planning part 3. How many of you guys have gotten to this point on your project? All right, so the next step in your volunteer project planning process is to interview members of your community. Now, I know that's going to be a challenge right now because of our current circumstances, but that if it's people that you know, you can reach out via phone call. You can also do, online meetings. I don't know how comfortable you guys feel about just scheduling your own online meeting. Phone calls are always good, right? Or emails. So interview your friends and neighbors and community leaders and active community members to get an accurate picture of your community's needs. A lot of the times, the challenges that we face when we start doing projects in our communities, sometimes we look at it just from our perspective, and we're coming at it from this top-down approach instead of listening to what the community needs and adapting our ideas to meet our community members' needs. So it's why it's important to be able to speak to the people in your community, find out what they're really interested in. That's been a challenge when we start working with, within our drug and alcohol field also. As a drug and alcohol counselor, sometimes we have an idea of what we think our communities need, the information, the education. But if we listen to what our communities are actually asking for, we may be way off the mark, totally somewhere else. And so it's so important to listen to what your communities are needing. It can be very challenging because it doesn't usually, most of the time, it doesn't fit along with our own agenda. And Sandy knows a lot about this. Well, all of you guys do because you work with your communities. So get that feedback. Get the feedback. Talk to your community members so you can get a full picture. The cool thing about this is you have an idea at the beginning. You talk to your community, and then all of a sudden your idea starts to become more refined and more defined. So your focus becomes more effective because you're listening to what the needs are, and you're able to adapt it to work with your project. So imagine how effective that project is going to be, and how effective whatever it is that you're planning on doing is going to be, the population it's going to actually impact and make longitudinal changes for. So it's important to hear that voice. Use the volunteer project interview worksheet on the following page to guide your interviews. After completing the interview project, compare the responses you received to your own answers in the community needs and resource sheet. Did you identify similar needs? Were the needs different? How did your interviews help you understand more about your community's health and wellness? Now this, for you guys, for Painted Horse staff, for anybody really, when we start looking at making changes in our communities, this interview process, this is going to be very valuable information. It's going to really help you direct where you're going to be moving your project, and actually the target population. And so if we know we're looking at elders, we're going to approach that differently, right? If we know we're looking at teenagers, let's say from 13 to 19 years old, we know we're going to do that differently versus our younger youth, our little guys. We're going to address that differently. So what is the greatest health challenge? This is on page 89. So what is the greatest health challenge you are currently facing? Now that is a very broad question. When you are doing interviews, make sure that you are not leading somebody. Let them openly answer. We sometimes have the tendency, it's just by nature, it's not like there's any malice or anything in it. We sometimes have the tendency to lead people in a specific direction when we're asking questions to get a specific answer. So when you do your interview, the best thing to do is just read the question. What is the greatest health challenge you are currently facing? Be a little bit wary of, like I said, guiding them to a specific response. Let them answer it openly. If somebody says, I'm not eating right, you can actually take that down and make it a little bit more to another level. I always think about, you guys have all seen Shrek, right? When he's all, it's layers. I'm like an onion. I'm layers. We are all in layers. I mean, that is so, so ironic. But if you ask them, okay, they're having trouble eating. Well, what's the problem with eating? And maybe you'll come all the way down and it ends up being that they don't know where to find recipes, or they don't have the money to buy fresh vegetables, or they don't know their vegetables. You know, you start breaking it down to what the real issue is that's led to the overall problem. So that's always good. So what do you think is the greatest health challenge facing your community? Just be prepared, when we all know this, that when we have open-ended questions like this, sometimes people will see it as an opportunity to vent. When somebody is venting and starts going, you know, getting a little bit upset with what's going on, then it leads to something else. The best thing to do as a community worker, and especially when you're doing an interview like this, is just to validate. Don't go into the blaming. You know, oh, you should go to your business committee, or it's because Sandy Manning just always wants to do walks. Always step out of the blaming process and just do the validating, because a lot of the times people just want to be heard, and they just know they just need to be, you know, say what they need to say. So one of the best statements to say in a situation like that, being in the field that I'm in and working with the community, I've had this happen quite a bit. The best thing to do is, and watch your face, it's called your affect, you know, watch your face, but just thank them, sincerely thank them for, you know, thank you for sharing that with me. I know it can be difficult. Then you put this back to them for solutions, be solution focused. What do you think you could do to help with the situation? And then how? Don't ever take the responsibility. Don't say, what can I do to fix it? You're always there just to offer support. So it would be like, so what can I do to help support you with that?
You should practice with somebody in the group, Michelle. Give us an example.
Of course, if you guys want to do that, we can do that. That's one thing I've really learned, though. If you practice those responses, it reminds me of like the stop, drop, and roll. We learned that all through school, right? So if any of us were to start on fire, we automatically know stop, drop, and roll. But it's always good, especially, and I know you guys have probably faced this a lot working in the communities. People come in frustrated because of this, and that. They're looking just for validation. And so just to validate them with their opinions, it's not that you're saying they're right or they're wrong. It's just like, thank you for sharing. I can see that you're really frustrated with that. What can I do to help support you? But never, ever, ever make yourself be the person to find the solution. Because then if it doesn't work, where does the blame go? It goes back to you. And people just have a tendency. This is just a tendency. It's not, you know, there's a lot to that, but people have a tendency.
What about Michelle?
Yes.
So I got a couple of things here. So you're saying that we're not to be the solution, right?
You can.
We're not supposed to give them a solution, right? You said.
No, you can give them possible solutions, but not like, so if I were to come up to you and say, do you know what, Chris? Your guys' gym is always closed. I don't even know why you guys even do all this working out. You don't even come to my community. I live clear down in Richardson's, and there's all sorts of people in there, but you don't even come down there. I always see you guys up in Randolette or White Rocks. Heck, you guys even go clear over to Mighton and down to Ouray, but we're just right here. Why don't you come up here? But then all of a sudden, if you're like, okay, well, let me fix this for you. We'll come up with this. Then you say, I will start personally coming up to your neighborhood on Tuesdays at 5 o'clock. So all of a sudden, if that doesn't work, that was your solution. And then I can blame you because that didn't work. It's like, Chris, you told me you were going to do this, but you just didn't even do it. Your program's horrible. You're horrible, blah, 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 blah. So it's not that you're not you're not making yourself the solution or finding the solution to the problem. You're like, so what you could do in a situation like that would be, thank you for sharing your frustrations with me. I can see where that would be frustrating. Here's our gym hours. I can possibly, maybe you could write this, or we could talk to Cassandra or the director, or, whatever, and find some possible solutions. What solutions do you think? So you give that back to them, help them problem solve. A lot of the times we sit on this fence and we want people to solve the problem for us, but we need to practice solution solving. But when
Hey,
you
Chris.
go
Yes,
ahead.
sir.
I'm sorry, Michelle.
No, you're fine.
How would you respond to that? Because I know that you're like, I'm pretty sure you heard this like every so now and then, right?
Yeah. I tell them that we do the best we can. We
Perfect.
do the best we can. We don't get to everybody that we would like to or want to, but we do the best we can. And if you want to, you can come into the gym, and there's a few trainers there that'll be more than willing to help you if you come in at a certain time or whatever you want. And then we could talk about coming to your community meetings and then doing a little exercise while we're at the meeting there, while you're before the meeting or after the meeting. Those are those are things that I tell people.
Perfect.
But a lot of times too, it just depends on the situation, I guess, how it goes. Now, one of my questions too is like when you said when they start venting, right? You says, what do you think about the greatest challenges facing your community? And then they say whatever it is, and then they start going into this whatever, right? You said, and they start venting, and then it has two questions there. It says that part, what do you think is the greatest health challenge facing your community? And then it says why. So could you use their venting as why? Because they're telling you basically why while they're venting, right? Wouldn't that be like why they're telling you in that venting capacity, and then you could use that for the why?
Yes, you could. You need to be careful though, and make sure that you're really looking at what the why is.
Yeah.
A lot of the times you will see the tendency to put the blame somewhere else. So all of a sudden it'd be like, well, you guys' gyms aren't open long enough. Your hours are wrong. They don't work for me, or I can't get there on time. I get to work and then you guys are always closed. So you see there's this component of it's somebody else's fault, but the real problem is what? It's also their work schedule. It could be the times of the time the gyms are open. But if it comes down to it, you're going to look at the why is maybe the person, because of their own personal schedule or scheduling, is unable to utilize a program that's already there. So yeah, I mean, there's a lot of fine tuning. I guess the biggest thing I would really like you guys just to be wary of is do not get into the blaming game. Just always be solution focused, always help people find the solution, and then always offer support. Don't solve the problem for them, offer the support. So with your projects are part of that support. Your projects are, let's say if we, like we talked about the food, people have a hard time, they want to eat right, but maybe they don't really know how to read a recipe. Maybe they don't really know what certain like leeks are, if a recipe is calling for leeks, or even how to prepare a leek. Now I'm using that as an example because I had to cook something with leeks just a couple weeks ago, and I did not know. I had to look on the internet to how to prepare a leek. So, with those type of things, it's like, it's that stopping them. So what's the real problem? It is understanding and knowing vegetables. So how could you help deter that? How could you provide a possible support and solution? Maybe providing a little book or handouts or a poster or posts about certain vegetables once a week. So
See,
you
that,
had to
I was
see.
gonna say that if you like do an interview and then like whatever you're interviewing on, make sure to have some information, like something visual for them to look at because I think that would help kind of like a deeper understanding where like they could read it instead of having you have to repeat the same, answer all the time. You could just be like, these are some questions and answers, or like even recipes, like have like a thing of recipes and be like, I've tried these are good, something you can like prep ahead, like,
Yes.
stuff like that. Oh gosh.
So those type of solutions would actually come after when you start engaging in your program, in your project. So this right here is just to hear the voices of your community members. But that's exactly it, because it's like, if you love to cook, if you love to garden, if you love to run, I just have to shake my head at you. I'm just teasing. I'm just teasing, Bodney. But if you love to do these things, you're going to be able to provide that information. You're going to be able to listen to what that person is needing. Maybe somebody who wants to start running needs to know how to do the stretching, right? Maybe they're running and they're not wearing the right type of shoe, or they're not getting, stretching properly, or they're not hydrating properly. And then that could be part of your focus. So these questions are to help you hear what the community is actually needing. So what are the most useful resources in your community? You guys' program is such a valuable resource. Each and every one of you is such a valuable resource, because every single one of you have a strength that brings to Painted Horse, that makes it the way it is. So, but let them hear from them what they feel their community resources are. So remember, don't try to sway them, just let them give their response. If you were able to choose one health-related issue to work on, personally or within a community, what would you choose? How would you address it? So this is going to allow the people that you're interviewing, your community, to give input, to have personal investment into what you guys are doing. So yeah, so one of the things though is, don't just, mainly when you're doing interviews, just stick with the question, just read the question. When somebody starts to vent, just acknowledge, just validate them. Thank you for sharing that. That's difficult. Don't push blame, but then ask them for solutions. What kind of solution do you see? What do you see? What do you think would help? And then how can I support you in that? So it's just not about offering solutions, because if it fails, you can offer possible outlets, a way to get this solved, but don't put yourself into solving the problem. Because then if it fails, then blame steps in, and then it's like your fault. You guys, so if you guys ever want to practice this type of dialogue, yeah, I'm all for it. It's always good. It's a good thing. All right. So up to this point, this is where we should be on our volunteer project interview. Now, part of module 7, when we look at the volunteer project planning part, this is on page 101. So in this step of your planning process, you will think more specifically about the details of your future project. Use all of the project planning forms you have already completed to help you with this stage. After reviewing your completed forms, work with your extension faculty mentor. Now, this is where we need to have a discussion about this, both with the group and both internally, because we have identified Miss Susie Prevedel as your extension faculty mentor. But there's a lot of us, and there's only one of her. So we need to kind of go over that a little bit, and make sure that that's something that she would be able to, and is still willing to do, granted with her schedule and with the work that she has to do. So on this project, part of the project, us as an internal team need to talk about this just a little bit more. The reason why, and with the Master Health Volunteer Program, is we want to really maintain the integrity of the way the program was designed. And to maintain that integrity, it's important for you to meet with your extension faculty mentor, right? That's part of the program. So I really want you guys to be able to get everything up to your interview. Okay, the community interview that was done in step 6. And then at our next meeting, we will know where we're going to head in this next direction. Are we all good with that? Claire, do you have anything you want to add to that?
No, I think that's a very good overview of everything. But again, if I'm also happy to help bounce ideas off of whatever for projects and everything like that too. So there's lots of resources for you guys out there to plan your projects. I know it's kind of intimidating to go through the course curriculum and then also be thinking about your project at the same time, but we really want you to be successful. So feel free to ask for whatever support you need.
Perfect, thank you. So that was our quote unquote quick review. So what we'll do is next week I will, so Miss Cassandra, what is your staff's schedule kind of looking like next week?
For Tuesday? Are you talking Tuesday or are you talking for the week or which
The whole week.
are we gonna do?
So I can kind of come plant myself at your house, at your guys' building.
It is my house.
Yes,
My house more than my own house is my house.
So I can come plant myself at your house and, you know, of course, like I said, with my social distancing, my mask, and be there to offer any support or questions for your guys' staff.
Okay, so Chris is here every morning. Jenny's here two days in the morning and 2 days in the afternoon. Shay is here Monday and Wednesday. Is that right, Shay? Jess
Yeah,
is here
Monday
Monday and
and Wednesday. Yeah.
Who am I missing? I think that's it, right?
Jeanette?
Oh, Vodney
Yes.
is here.
Jeanette?
Jess is the
Oh, and
same
Jeanette.
schedule as Shay.
Oh,
I have the same schedule as Chris.
hi, Jeanette.
Hi, can you hear me?
Yeah.
I can hear you.
So I can't
Oh.
come in with Chris.
So
I'll
maybe
be there with Chris.
maybe what we can do, Sandy, if you could just put a paper up and you guys just sign in a time, just put a time in when you want, if you want to, because this is, I'm just going to leave this open for if you want to. You do not have to meet with me, but if you would like some extra help, if you want some extra help, if you want to practice some of this engagement, you know, whatever it may be, maybe sign down a time so we could work like an hour. So like, let's say if somebody on Monday at 10 o'clock wants to meet with me, just sign down, and then Sandy can let me know those times and I can be over there. Because we are getting close to this ending, and I want to make sure that everybody is getting the help that they want and need.
Can I just tell you a time now?
Yeah, of course.
I'll do Tuesday at, let's go 10.
Okay.
So we're not having a Zoom class next week then?
Oh, that's right. We are having Zoom at 10.
Good.
9.
Yeah, we can do 9.
Yeah, we can do 9. Perfect.
Okay.
All right. So if you guys want to meet with me, just drop a time. You can even put it down in our on our Facebook page. Just send me a message in there, or just write it on one of the posts and just let me know.
It's for next
Put it in
week,
chat.
Yeah, it'll be for next week.
Hey, Sandy,
Chris,
Yes.
when does the T2 session start?
Oh, on
Yeah,
the
that's on the
12th.
10th. That's at 10
On
o'clock.
the 12th at 10.
Yeah, because
Yeah.
we're going to be missing next class.
Oh, so
Okay.
we'll have to reschedule our Zoom then. Because we got our Prevent T2 starting next Tuesday at 10.
All
And
right.
on Wednesday at 5.
So let's do, how do you guys feel about doing our meeting on the 13th then, on a Wednesday at 10? Would that work for your guys' schedule? All right, put that in your notes. We are going to reschedule
Yeah.
our meeting for next week on the 13th at 10.
13.
Perfect.
Yeah.
Okay, so yes, let me know. And like I said, it's not required for you to meet with me individually, but let me know if you need some of that extra help, not only on your projects, but also on your modules. So within an hour, we could probably, if there's a module that you're stuck on, if you need to, we could go work through that module one-on-one. Well, I'm sure we could get a couple of them done if we needed to. So Flo, if you need to meet me at my office, or if you want to do a Zoom, let me know and we can schedule up a Zoom to work on that. So we have a lot of options. You just need to let me know the times. And like I said, and like Claire had said, we're all here to help support you with this.
Okay.
And just think about what we could do or what things can be done to help improve this program. So when you guys are out in the community doing it. So when you volunteer for the next cohort to be the one in charge. Just saying. All right, so we're going to leave our review of Module 7, which is social health, on to next week. So I would really like you, by next week, next Wednesday, I would like you guys to be up to this point on your projects. Have those interviews done. Make sure you have those I think the interviews, at least have them started. Okay, at least hear at least 5 people in your community. Get some feedback from them. And then and email me a time if you want to meet. Let me know if you want to come over here to my office. So Chris, is you 5 o'clock?
Yes.
Are you raising your hand?
Yeah, I'm raising my hand. You said 5 people, and it said on that thing, didn't it say 2 to 3 people?
Oh, did it? We'll follow the
I
page.
mean, I'm just making sure. It says, the thing says 2 to 3 people, but you said 5 people. I just want to make sure that
Hey,
I got it.
are you like mincing words here? Follow the instructions. Yes, thank you for the correction. Yes,
Okay.
just do what the paper tells you to.
All right. Because I could interview 5 people, but
wait, Chris. No, you go ahead and do 5. I'm gonna make you the exception to the rule. You do 5.
All right, I'll write that down then. 5 people.
So when you guys start doing your samples, I want you to realize that when you're doing these sample interviews, what they're doing is it's a representation of your population. So with this, they're saying that this amount of people is going to be, a good enough representation for your project and feedback. So, but yes. Kay, do you guys have any other questions or comments? All right.
Let me lots, but I think we need
what was
together. That? I said I have lots, but I think we need to get together. But I wanted to team up with Chris so we would kind of help each other because I think he's as lost as I am.
We got 8 minutes.
So yeah, so I'm like, next week.
Yeah, next week we could get together with you, Michelle, or whenever. Sometime this week too. Sometime this week, because what's today?
Today's
I think I'm gonna have to have 1 or 2 meetings with you because I'm like
that is totally fine. I'm not limiting this to just one. You only get 1 help card. I will help you as much as you need because
I need a punch card.
Yeah, that's right.
It's on my notes. Some of because I started late, so I'm like, when it said get with your person, you should be on your second meeting, and I was like, I didn't even make the first meeting, so
that's okay.
I didn't know if we were supposed to meet with you or with Claire. Okay. I didn't know where that went.
All right, so what we'll do is I will do what we'll get you where you need to be, and if we need to meet more than once, that's totally fine. That's what we're all here for, because this is about making the program successful and helping you be successful in the program.
Michelle?
So, yes.
Why don't we set a time each day, and that way if they want to come in, and you'll be available here during that time, and if they need extra time, they can schedule with you.
No, that would work. Good.
Because they'll all be coming in at some point.
Yeah. So even though I may not come across this way, I'm a morning person, so I would prefer at 9.
Maybe we can entice you with some breakfast.
9 o'clock and a cup of coffee is always a perfect meeting for me.
I think we're gonna need a bigger coffee pot.
So what we could probably do if we did 9 o'clock and 3 o'clock in the afternoon, usually that's in between. I don't normally have meetings that early or that late. So let's do 9 and 3 o'clock.
I'd say when I get into past module 6, then I'll probably start needing help, because I have to pull my other books out too and start going through what I want to do, because I'm trying to be realistic for myself, where, you know, I guess honor the social distancing, but be able that people have access during the time of meetings and stuff. So yeah, I haven't gotten that far yet, but I'm getting there. So just letting you know.
Yes, no problem. No problem, you guys. I really appreciate your willingness to participate. I know it's always different when we're having to do modules because we're such social people to just do this on your own. And so I think that's one of the things that we wanted to do with this whole cohort was to let us all know that we can work together, even though we have some different distancing challenges at this point. So yeah, you know, the help is there more than once. You can, you know, and Chris knows this, you can call me up, send me a message if you need to talk about a part of the project, or if there's any challenges, feel free to do that. But also, like I said earlier, I want you to be thinking about how we could fine tune this project, how we could, as a group, would it be better if we went through each module together weekly? And then that way it's more like a class, because, you know, this may work for some, the way we're doing this may work for some, it may not work for others. We just need to hear, you know, get that feedback from you guys. So when the time comes, I know we may survey you out, but just, I want you to remember the reason why we are doing that is because your voice and your input is important. This is an important little cohort that we've got going on because it is the first one for this program. So your voice is very important, and your input is going to help get this refined, get this process to be more fluid. You know, and of course, I think we're always going to face the challenges of technical difficulties. That's just the age that we're in these days, right? But so please give your feedback and realize that you guys are valuable. You are very valuable. And what you're bringing to your communities is going to be very valuable. But the best part about this is you are going to be able to learn, and by putting your programs out there, you're going to get your community invested in that also. And then that ripple effect from that investment is going to take it in a whole nother direction. So what you guys are starting, and with your projects, what you're doing is you are starting, it may not feel like this right now, but you are going to start a trend where people are going to start, okay, we know how to do this. You're going to model what this looks like. So thank you guys for your participation. You guys are awesome. So next week, either at 9 or at 3 o'clock. And then just quick note, we will send out a reminder email. The Master Help Volunteer is on the 13th at 10 instead of Tuesday, the 12th. All right. Thank you guys. You guys are all very awesome. I'm glad you all made it through 2020. Let's make this year kicking, right?
Yeah. More healthier anyway.
That's right.
Yes.
That's right.
Yep.
All right. You guys all have a good day, and I'll talk to you later.
Thank you. We'll see you.
Yeah.